Well, look at this. Top Democrats continue to avoid talking about and not jumping on the single payer bandwagon, those Medicare for all plans pushed by Kamala Harris and Bernie Sanders. There are at least 8 Democrats we're talking about who are saying, not right now. Nancy Pelosi, Dianne Feinstein, Tim Kaine, Amy Klobuchar, Gary Peters, Michael Bennet, Dick Durbin, Bill Pascrell. They're not all hot about this idea, this policy idea. Let's bring in a top expert, Seth Denson. He is president of GDP Advisor. He's a healthcare pro. Seth, why are they running away from talking about it?
I think what those that have been there for a while are realizing that while this makes for good politics sometimes, it really doesn't make for good policy. And eventually those chickens are going to come home to roost, and they're going to have to really stand up for what they do or don't support.
You know, Seth, you probably saw this coming 9 years ago. Obamacare was being called the one stop, the halfway house to government-run health care. And now we've got Sherrod Brown. He wants to become president. He is saying, yes, get rid of private health insurance. Are you surprised with the speed, with how fast they're talking about doing that?
You know, I am, and it's disappointing, and what most people don't realize is that if you eliminate the free market structure of the way healthcare works, not only are you eliminating millions of jobs in the United States, because healthcare is a sixth of the U.S. economy, but you're also ending innovation. The United States is responsible for 70% of the world's innovation when it comes to healthcare, and that's our free market capitalistic system that does that. You eliminate that, we're not curing much of anything anymore.
And Seth, you make an important point, because we're hearing from doctors and hospitals, they can't stand the paperwork that is already inundating them from government-run health programs via Obamacare. They don't like it at all. And to your point, Seth, Kaiser Family Foundation, it's a nonpartisan shop. They did a poll. They found that when you say it what it is, it's single payer, people don't like it when they hear the facts. For example, when they were told it would eliminate private health insurance, the approval rating plunged to 37%. When it said it would threaten Medicare, fell to 32%, Seth. And when they said, you know, it would lead to reduced care and delays in getting care, the approval rating plunged to 26%. 70% oppose it, Seth.
That's right, because what most Americans realize, it was the same thing that when they were trying to sell the Affordable Care Act, right? If you like your doctor, you can keep your doctor. What most people realize is that if the government is running a single system, the government's getting to call the shots. Nobody wants to stand in line at the post office to see their doctor.
Yeah, President Obama didn't like single payer. And, you know, here's the thing. Do you think that some of these Democrats who are running are swinging extreme left to keep the left base there? Because remember, I know this is a political question, but Kamala Harris came out as a tough prosecutor and a state attorney general. They didn't like her record as a cop. Maybe they're swinging way left because to do single payer because of that.
You know, I think that they're trying to grab the Bernie fire, right? Because they're seeing the movement that is there, and they're trying to grasp something that they can get a hold of. And when it comes to health care and the rising cost of health care, who doesn't want something that sounds like it's free? But the reality is it's not free. It still has to be paid for. And that just means taxes, losses of jobs, and losses of innovation.
Yeah, and taxes on the middle class. The middle class would have to pay taxes.
That's right. Yeah, I've said it a lot. You know, we always talk about it being paid for, but at the end of the day, the middle class pays the tab.
Seth Denson, great to see you. Thank you so much. Coming up, tensions close to boiling over in Venezuela. Opposition